recording is on what we can do from an integrative viewpoint, in the sense of how do we get the person's nutrition right? How do we get their microbiome right? What herbal remedies can improve their cravings when they're withdrawing from substances, become dependent on prescription drugs? Because in Harare at the moment, it costs $160 a night to go into rehab. And what happens is that the person comes out on more drugs than they went in on, but they just happen to be prescription drugs that are prescribed by a psychiatrist at $120 every 2 weeks. Now, before I actually continue, can I just confirm with you, Belle, that you can hear me?
Yes, Dr. J, loud and clear. Can also see you.
Excellent. Okay. My signal, there's a thunderstorm brewing here, so I might turn my camera off if it tells me that my signal's unstable. But at the moment, all is good. The technology is working. So let's start by talking about substance use disorder, an integrative approach. And I'm going to be focusing today really on the psychological rehabilitation. And it's not just of substance use disorder, it's of all mental health problems. So I think let's start off with a very important message. And this is a paradigm shift in thinking. And what I'd like to do at the end of this is to share this presentation or the link to it so that people can look at all of these links. This is a very, very good TED Talk, and it challenges that everything we think we know about addiction is wrong, because the opposite of addiction is not sobriety, it is connection. And people who become susceptible to addiction are very often people who have become disconnected in society. And as society gets more and more fragmented, we are likely to see more and more problems. So when we talk about mental health disorders, we talk about deaths of despair. The disability adjusted life year is a measure of overall disease burden expressed as the number of years lost due to ill health, disability, or early death. Now, in 2016, the burden of mental and addictive disorders was 7% of the global burden of disease. It affected more than 1 billion people, and depression was associated with most of these disability life years. By 2030, the WHO predicts that depression will account for the highest level of disability attributable to any physical or mental disorder worldwide. What is the magnitude of the problem in Zimbabwe? Well, we have over 5 million young people aged 10 to 24 years old, and they are at risk in Zimbabwe of developing substance use disorder. And it's probably the most severe public health and socio-pathological public health issues at the moment. So UNICEF in 2022 did a study, and they stated that lockdown drove many young people into mental health problems and substance abuse. And 76% of young people surveyed and of their parents were of the view that the mental health of children and adolescents had been negatively affected by the outbreak of COVID-19 and the hard national lockdowns that followed. A lot of young people couldn't cope with seeing their parents struggle to make ends meet during the prolonged school breaks. This lockdown in Zimbabwe added 3 million people to our extreme poor in 2021 alone. And this drove many young people into substance abuse and sexual activities, according to the survey. There was a significant rise in cases of physical and sexual abuse in homes, which affected the mental well-being of many young people. So, as mentioned, lockdown added 3 million to our extreme poor. A new term was coined called Uzi, and In Sanzukwi in Zimbabwe, the community stated they had a problem with the local youths. They took issue with what is known as out-of-school youth, the unemployed and the undereducated young people in the area. Viewed as idle and incapable, the boys would be seen down at the bars drinking and playing pool, and the girls would hardly be seen out of their homes at all. And the most persistent issues in the community continued to get worse. And there was a boom in teenage pregnancies, many of which were due to rape. So when people become addicted to substances, the attitude is just say no. There's posters everywhere that addiction is suicide. Nobody said, when I grow up, I want to be an addict. And the reason why addicts can't just quit is because they develop brain damage. And it's something that we must teach young people before they consume substances. So in the non-addictive brain, the frontal lobe is the control center, and it basically controls the limbic system, which is where emotion is contained, and fear, and many other areas related to memory. And the frontal lobe is able to inhibit and override behavior so that you don't go out and cause a fight with someone where you're going to get severely beaten up. It inhibits destructive behavior. But in the addicted brain, the circuitry is affected, and particularly with alcohol. But alcohol is a slow progression. It takes 10 to 20 years of heavy drinking to destroy those circuits. Whereas with cocaine, methamphetamine, those circuits can be destroyed in the first week, and they can take 2 years to recover. And if you want to have a look at the link, it is in the presentation. So what happens then with the families and friends? Well, once the person who has developed an addiction problem is getting into tolerance and compulsive behavior and is starting to steal money and sell furniture in order to maintain their habit, the family gets into significant conflict. And very often the addiction basically brings out underlying conflict. And the middle slide here, it's quite clear that the behavior of the two people in the background is going to provoke a child that just wants to run. He's actually vanished into himself if you look at his face. So we know that the drug is going to cause addiction problems in undermethylators, in other people who are genetically susceptible, who can't break certain drugs down. And defects in the methylation pathway are strongly associated with addiction, and you can often see a family history of addiction. And those people, if you run their genetics, which we can now do through genetics in South Africa and one or two other labs, you will be able to predict that someone is more likely to have a problem with addiction. But the environment is always important as well. And the drug has effects on the environment, and the environment has effects on the drug taking. But the drug affects brain mechanisms, and that is what leads to addiction. So frontolimbic connections are damaged. The frontal lobe is the site of executive function, inhibitory control, motivation, and drive. But after substance use or addiction, executive function isn't working too well, so the ability to prioritize isn't too great. And when executive functioning goes, people say that addicts are in denial. They are not. They have damaged their frontal lobe to the point where they are unable to self-appraise their own behavior. So when they say there's nothing wrong with me, it's either because they can't remember what their behavior was like, or because they've lost the ability to stand outside of themselves and self-appraise their own behavior. They lose inhibitory control, and that may be for whatever it is, whether it's a cell phone, whether they're watching porn, whether they are taking substances, or whether they have gambling addictions. And what also happens is that motivation and drive to do normal things go. So pleasure seeking overrides reason. And it's very important to understand that unless you stop the substance, this is not going to get better. And you can't stop the substance unless you can stop the craving for it. There are various rehabilitation centers that claim they can. They have approximately a 3% success rate in the long term. So we need to come up with a better plan. So novelty and curiosity are very important human traits that I think that are trying to be squashed out of our young people. Scientists have begun to better understand the brain and what really makes us tick. And it's become abundantly clear that while some addicts choose behaviors and others choose substances, their brains are really choosing the same thing, novelty. So what forms the addiction is not obsession over the substance or behavior, but rather what is next. And really think about that one. So it is the anticipation of what's new and what's next that sucks many of them in. And as they continue to engage in an addictive behavior and eventually build a dependence, you'll notice that what an addict does, and I think many of us probably are addicted to technology and to cell phones and to caffeine and a number of other things, a dependence is built. And then the behavior intensifies because you become desensitized and tolerance sets in. Whether it is tolerance to the substance or tolerance to being on your cell phone for 11 hours of the day. What used to be considered extreme now barely elicits a response, and the brain now wants novelty. What's new? What's next? And people like Michael Jackson and Heath Ledger, what was next was overdose and death. We are not created to live mundane lives that do not seek novelty, because novelty leads to innovation, adaptability. It's a survival advantage. But we must ensure that we are challenging this part of our nature in the correct areas of our lives. The irony is that when addicted, whether it's to the cell phone or to the substance, the capacity for creativity and thinking outside the box and exploration dwindle. So the pursuit of novelty is wasted and destroyed by the addiction. We've got someone who's not on mute. Pride, can you please mute them? So one of the don'ts, as I said in the preamble, what are we saying don't do? The Hippocratic Oath says first do no harm. And the current model is to lock people up with no rights in a rehabilitation center and put together people from all ages and treat them all. Please mute your microphone. So the tendency is to put people in isolation in a very mundane environment. And at $3,000 a month with 50 people in a rehab, it's become an extremely lucrative business. But it is something that can actually damage the person more. I experienced a geologist, a very, very successful geologist that went to rehab in South Africa for a month. And 3 days after coming out of rehab, he killed himself successfully because of the bullying type behavior that actually occurred there. So what you actually need to do is remove them from the substance. And there are ways of doing that without locking people up in a mundane environment and removing functional people from the job environment and destroying their careers. So in sobriety, the brain begins to seek novel experiences elsewhere, outside of self-destructive behavior. It might be traveling, making friends, trying new hobbies, but the brain will start to look for another way to get dopamine. And if you have a patient that wants to get better and is earnestly seeking freedom, one of the best things you can do is to recommend they start to take new novel things that take them out of their comfort zone. If you've got someone with severe anhedonia, you're going to struggle with that, but this is a long process. There is no quick fix. You need to give people an expectation of 3 to 6 months to start to get significantly better. This 3-week rehab that medical aids pay for is a complete joke. And it's not going to happen. And the longer the person has had a problem for, and the more traumatized their background is, the longer it may take to get them better. The resulting pleasure of new experiences that the person enjoys will add meaning to their life and give the brain a necessary outlet to experience novelty, both of which are necessary for long-term recovery. So we now speak of the term artificial exhilaration. Now, I was very fortunate to grow up before cell phones. I think I got my first cell phone when I was about 28 or 30 years old, and it was about the size of a brick. But when I was younger, we did a lot of things that people would be horrified with now. Jumping out of airplanes, parachuting, scuba diving, whitewater rafting, going very fast on motorbikes, you name it. Myself and my friends did it, and I probably would have a nervous breakdown if my children behaved like I did at the same age. But we've developed this safety culture which mollycoddles everyone, and it has removed exhilaration and novelty and excitement completely. And so now people need artificial exhilaration, which is based on substances. And that becomes a real problem because the exhilaration of winning Wimbledon, if you're Djokovic, and the dopamine rush from that is real. Whereas the exhilaration that will come from a dose of cocaine will be followed by a dopamine dump, and you will be in a vicious cycle from which it is very hard to get out. So the brain is hijacked by dopamine releasing substances. The frontal lobe is there in blue. The frontal lobe is your conscious control of behavior. The limbic lobe is your subconscious behavior, and the hindbrain basically runs your heart rate and your digestive system. It's completely unconscious. And people start getting into a behavioral cycle where they become intoxicated because it's driven by the rewarding effects of the drugs. And then the following day or a few days later, they go into withdrawal, they have a negative affect, or they start to crave, and they become preoccupied with becoming intoxicated again. And then when they do become intoxicated, they say they're only going to have one, but when you only one or two, you disable the frontal lobe. It's the first area and the most sensitive area. The frontal lobe becomes disinhibited, which is why people think they can dance when they're drunk and they can sing. And once the frontal inhibited, then the binge drinking or the binge behavior will continue. I'm not going to go into sleep because of time constraints, but it's a very similar vicious cycle for sleep. So we also need to understand that addiction is a family disease. Everyone's affected, and there are pathological relationships throughout the families. I've shown this slide before. The families and the friends don't understand what's happening, and it causes enormous conflict, and people just do not know what to do with the person who has developed addiction, and very often the person who has the addiction doesn't know what to do with themselves. So something that I think is really interesting that is coming out in the world of quantum medicine is we can actually measure electromagnetic fields coming off people. And the heart and the gut actually produce some of the biggest fields, and the field created by the heart and the gut is actually bigger than the field created by the brain. But just like everything in life, we receive signals into our eyes, which is a light wave, and we have between ultraviolet and infrared, we have a spectrum where we can perceive light. We have a spectrum where we can perceive sounds. Some people can hear elephants. I can't. It's too low. Some people can hear a dog whistle because the waveform, their sensory system is able to pick it up. I personally can't, it's too high. So it's not just our vision and our sight that works on an electromagnetic or a waveform. We also put out electromagnetic energy. And that's also why when someone arrests, we put defibrillators on and give them a good jolt of bioelectric energy. So if we look at a map of consciousness, you can measure what people resonate as. And I'm not sure if you can see my pointer, but most people in the medical profession would hopefully be resonating at a meaningful level, and they would be operating on reason, resonating fairly high at 400, quite understanding, but abstract in their thinking. At worst, they're willing and accepting of what's happening in life, and at best, they have love and joy. Very few people reach the stage where life is perfect and they have enlightenment. And I think you have to be a Buddhist monk to actually achieve that. But living in the stressful times that we do in the medical profession, I think that resonating at about 400 would be quite good. Now, if you take someone and completely shame and humiliate them and tell them that they're hopeless, they're going to be resonating at 20. And if they're resonating in the lower half of this graph, and their parents that we saw in this slide are extremely disappointed in their child's behavior, as you can see in the top left-hand corner, the child is being berated and is ashamed. If they are resonating in shame and humiliation and fear, and particularly maybe there's been a grief, maybe somebody's died in the family, maybe there's been a divorce, what happens is if somebody perceives that their life view is very disappointing, then they are likely to have increased craving and they become enslaved. And so we as medical professionals who condemn people who are addicts, or parents or friends who condemn people who've become addicts, and where it becomes a real problem is the medical profession creates a lot of addicts inadvertently by prescribing benzos and opiates, because prescription drug addiction is far more of a problem. Just because it's legal doesn't mean it doesn't destroy lives. So one of the paradigm shifts I need people to see is that beating people into submission and criminalizing addiction is basically going to promote craving. And then if the person cannot stop the substances, then the brain damage continues and you're in a vicious cycle, and they are an addict for life. But they are an addict for life because the system keeps them in the hole. So let's take a 51-year-old male who's HIV positive on ART. Now, TLD, dolutegravir, causes significant insomnia. It's a side effect many people don't know about. And insomnia generally ends up with someone on benzos or marijuana or alcohol to sleep. This guy's been drinking 2 to 8 units a night for stress and to sleep for years. He's self-employed, quite successful, but things are starting to go horribly downhill in his business. When he was younger, like many, he drank excessively when he was at university. He binge drinks once a week or so when he sees all his mates. And on a Saturday night, he is divorced because his wife couldn't deal with his substance use and his abusive behavior. He's depressed. He's tried an SSRI. He's now on liver detox. He stopped socially interacting. He never really goes outside. He works and goes home and drinks in front of his TV. He developed irritable bowel type syndromes, including diarrhea after a huge binge, which have not resolved for a week. And he's producing offensive, runny stools with a lot of urgency. And he's really feeling miserable because when the microbiome is out, the gut-brain axis that we've discussed before will cause people to feel miserable. He tried to stop drinking, and after 1 to 2 days, he had severe craving, anxiety, insomnia, sweating, shaking, nausea. But alcohol stopped the withdrawal reaction. He tried again to stop with the same result, but this time the withdrawals were worse. And he's come in and said, I need help. So he describes death by duvet, anhedonia, severe fatigue, can't out of bed, can't be bothered to do anything, very low mood, no motivation, brain fog, this runny gut with cramping. And when he's stressed, it's even worse. And he describes death by duvet. Now, I'm sure everybody in the clinical world has seen this patient or someone similar to him before. And if you haven't, you've had a discussion with their spouse. So the GP diagnoses alcohol use disorder with severe depression. He advises admission to hospital, which is going to cost about 3,000 US in the private sector, or 160 a night if in some of the places. And he advises referral to a rehab in South Africa, which is going to cost 6,000 US dollars for 2 months. And they've said he might need to be there for 3 to 6. And he says, I can't leave my business. It's financially not feasible. They take away everything in rehab, phones and computers. How do you expect me to survive? So, sorry, my slides are not moving. There we go. So you suggest that you refer him to psychiatry, and he's offered more pills. And he refuses. He's been to see psychiatrists. He's sick of the whole thing. And he wants some sort of help without ending up on prescription drugs as well as alcohol. So what are you going to do now? Well, holistic management involves managing depression. First, you check there are no contributory nutritional deficiencies. We've been through this in previous talks. Fix the gut, manage nutrition. Main thing, remove toxic substances so the brain can heal. Improve immunity, and he needs psychological rehabilitation. So if you go onto Google, which is search engine optimized, you need to check his liver with imaging. You consider starting antidepressants, and then you give him a course of diazepam to reduce the severity of his withdrawal symptoms, when in actual fact you expect in 2 weeks' time for him to be addicted to both, because benzos very rapidly deplete GABA, and then the GABA is not restored and the craving gets even worse. So you end up with a double addiction. The only thing I would agree with in the conventional treatment is the giving of thiamine or a multi-B, and you do need to get him to a place of safety, even if only for medico-legal reasons. But conventional medical therapy is almost useless until nutrition is restored. He's living on a diet of takeaway chips and pizza. He's getting no sunlight, no exercise. His stress levels are through the roof. Up to 80% of people with an addiction to alcohol develop thiamine deficiency because of inflammation of the gastrointestinal tract. Thiamine deficiency causes loss of appetite, worse nutrition, constipation, fatigue, blurred vision, changes in heart rate, irritability, nausea and vomiting, reduced reflexes, tingling in the arms and legs, shortness of breath, muscle weakness. And if you look at the progression of alcohol withdrawal syndrome, you will see that mild withdrawal and severe withdrawal actually cross-react with thiamine deficiency. So you won't know where you are unless you've actually given this patient decent and high doses of thiamine, and you can't really overdose with it. So I'm very into African solutions for African problems. This is about the 20th time I've probably shown this slide. But we also need in Africa to understand that mental illness is a taboo subject that attracts stigma in much of Africa. Ugandan studies show that the term depression is not culturally acceptable. Nigerian studies show that a third of patients will cite drug misuse as the cause of mental illness, and about 1 in 5 will say it's divine wrath, the will of God, or about 1 in 10, 1 in 8 to 1 in 10 will say it's witchcraft or spiritual possession. So when you're dealing with that demographic, trying to impose the DSM-5 Western criteria on a completely different demographic and call it anxiety and depression is going to be a disaster. And the results of the social stigma is that in much of Africa, mental illness is a hidden issue, equated to a silent epidemic. These people are locked up inside of huts or inside of houses. They are hidden for fear of discrimination and ostracization from their communities. Girls from homes known to have mental health diseases don't marry, and the silence is compounded by poor policy decisions. This is a study in Zimbabwe from 1995. Spiritual factors are frequently cited as causes of mental illness, and traditional healers get involved. And I think we should be working with the traditional healers, not against them. So let's come up with a new word that becomes culturally acceptable. And the Shona word, and I'm sure there are other words in other cultures, is kufungasisa. And when people are told kufungasisa, they will often break down and they will sob and they will say, yes, that is what's wrong with me. It's a non-psychotic mental cultural factors play a profound role in the manifestation of such illness. And local idioms and concepts of illness need to be understood and related to the biomedical psychiatric concepts originating in Euro-American cultures. And if you want to click on these links when you get the presentation, you're welcome to. Everything is referenced. It's a cause and a symptom of illness. Patients and care providers view this term as being related to mental, social, and spiritual distress. It's strongly related to the biomedical Western constructs, but it's not called anxiety or depression, which carry a social stigma. It sort of means feeling stressed, and it will increase awareness and recognition of mental illness that is not psychotic in both primary care and among patients. It means thinking too much. And again, it denotes both the cause and the symptoms. It has been validated in Japan. There is a site called 30,000 Days, The Art of Taking Action, and it's a completely new approach to approaching psychology from Japan. And they state, and for an ancient culture to state the association of thinking too much with mental health problems is innovative, is quite surprising, because I would say that overthinking is something that we would all associate with mental health disorders. It's an obstacle to people moving forward in their lives. You can't figure out life in your head. The highly intellectual people will attempt to figure out a problem in their head, and the lack of intellectual resolution results in a lack of action. So than psychology, it's a natural approach to mental wellness. I'm going to turn my camera off. I'm losing internet. And it involves the art of taking action and meditation to quiet the mind and manage thinking. So, kufungasisa is a much more useful word than the word depression. So what psychological strategies can we actually use? Again, to emphasize the point, we're not trying to get someone sober by locking them up. We are trying to reconnect them with normal society. And I really do encourage you to listen to Johan Harry's talk. It's very insightful. So in Zimbabwe, we have something called the Friendship Bench. And it was started by Dr. Dixon Chibanda, who is the head of psychiatry in Zimbabwe. There are 12 psychiatrists in Zimbabwe, or they were when they started this. I think there's a few more now. And the YouTube link basically says there's no way that 12 psychiatrists can look after 15 million people. And he describes very eloquently in one of these YouTube clips a girl called Erica who successfully commits suicide in a town 2 hours away because she didn't have the $15 to get the bus to Harare. And it's a story of real tragedy. And that is the reality of Africa. We can't be using all of these international guidelines when we are in an under-resourced setting. But the main thing about the Friendship Bench is it is a place of empathy, belonging, and connection. And the opposite of addiction is connection. And we can train grandmothers in cognitive behavioral therapy. He also describes a woman called Farai, who is HIV positive and a mother of two. And he describes grandmother Jack, who actually sees 257 patients before she passes on. And she has an enormous amount of meaning in her life. And she's trained to say things like, I'm here for you. Would you like to share your story with me? We have a very different culture in Africa. In European culture, the language structure, because English is my first language, says I see. The African languages say I hear. And it's all about storytelling. 6 sessions on the friendship bench later, Farai is no longer planning on killing herself and her 2 children. She's employed, productive, has purpose and meaning in her life, and she has a gogo who cares about her and makes her feel like she matters. A lot of this work was inspired by Professor Bruce Alexander, who worked with addicts in Canada, particularly in the 1970s. And the thing I like about him, because you all know that I like constructive controversy, he received a prize for the support of controversy from the Simon Fraser University. He is known as creating Rat Park. So he created Rat Heaven, which had running wheels and a big area and lots of food and anything a rat could possibly want in its life. And then the other rats were put into isolation in a cage. And he fed them both morphine. The rats in isolation consumed hugely amount more morphine than the rats in rat paradise. He did show that both caged and park rats showed a decreased preference for morphine in certain genetic groups. There was a genetic difference. So is it nature or is it nurture? How do you measure area? What's more important, the length or the breadth? Well, you can't measure area without both. And you can't analyze someone based purely on nature or nurture. It is a dance between the two. So other studies have supported the conclusions, finding that environmental enrichment induces neurological changes that would serve to decrease the chances of opiate addiction. So putting a cell is certainly not going to help. And he was very big. It arises in fragmented societies because people use it as a way of adapting to extreme social dislocation. You can't cure it because it's not a disease, it's not a moral failure. It is an adaptation strategy to fragmented communities. What are we seeing in our young people? Well, this is what I'm seeing, and I fight with my own children who are in their 20s, who seem to think that life is in the end. Although I'm not much better sometimes. And what all these people demonstrate is isolation and exposure to screens and drug taking because they've lost connection. And is substance use disorder, at least in part, a disease of modern societal dislocation, in which case we need action at governmental and policy level. So what can you do for your 51-year-old patient who really is at the end of his tether? You need to stop the substance so the brain can heal. But you're not going to stop the substance unless you can stop the craving. And there are nutrient and herbal strategies and behavioral changes that can help that. There are online resources. You can use your communities, like the Friendship Bench, which is cognitive behavioral therapy. Doctors and healthcare workers need to understand what neurolinguistic programming is because it accesses the subconscious. Medical organ therapy, we're going to have a whole lecture on the 14th of March with somebody who is one of the experts in it, and I'll go into it a bit later. And we can create communities that are not socially fragmented. I recommend you listen to Jordan Peterson. People say he's controversial. Actually, he just calls it like it is. Jordan Peterson had to go into a rehab because of prescription drugs that were prescribed when his wife got cancer and he couldn't come off them. And we need to understand that someone who is as strong a person as Jordan Peterson can also become the victim of a doctor's prescription pad. And his first 3 rules of life are: stand up straight with your shoulders back, treat yourself as someone responsible for helping, and surround yourself with people who demand the best from you, which doesn't make your life any easier. Because we all need to do something that is above us, because we need to do something worthwhile with our lives. And we need to do what is meaningful, not what is easy and expedient. Esther Perel, I recommend. She does a lot of work on repairing relationships. In this particular picture, we can see what the relationships are. What I do, the guy on the right, will trigger a reaction in the woman on the left. And her reaction will trigger a reaction in him, and both of their reaction will trigger a reaction in the son. So what I do makes you do something that makes you react to me, so that then draws something else out of me. And each person actually creates the behavior of the other person. A relationship is a figure 8. It's a backwards and forwards thing. And we all know that we can be completely different people in front of different people. So certain people will trigger completely different behaviors in us. We know that a relationship is over when there is indifference. In a house where there's an addict, often the parents and the siblings and the relatives are indifferent. And the contempt, because we treat people with addiction with utter contempt because they've lost self-control, because we don't understand the biology. We treat them with neglect. We leave them to not eat and to not bath. And very often there's verbal and microaggression and passive-aggressive behavior. We induce shame, we become aggressive, and we treat people with contempt. And we don't understand that by doing so, we basically have a life view that they are disappointing. They will resonate at a naturally low frequency and will crave and become enslaved drug. Whereas if we were able to be more positive with them, could we possibly get them out of the vicious cycle? As a cardiac patient, I do refer to him as a diabetic, I will say, but that's because he cheats like mad on his diet. I don't refer to my best friend who lives in Victoria Falls as a cancer patient. I don't refer to my partner as a back pain patient, and I don't refer to another friend of mine as a Crohn's patient. But we refer to people as an addict. And these are the images that are created: shame, blame, contempt. And the person on the lower right-hand corner over here has a handful of pills. And those handful of pills, I will almost guarantee you, some of them came with a doctor's prescription. Who creates the addict? Not all addicts come from a gutter injecting heroin. Many of them start with an opiate prescription in hospital. And we need to remember that the pharmaceutical industry, for which I work, have an attitude that a patient cured is a customer lost. And with addiction, we need to cure this or put people into a long-term solution, because putting these drugs down their throats very often destroys their life. Benzos, particularly alprazolam. I went to a funeral earlier or late last year. In fact, it was July, August last year, of a young man who's very good friends with my daughter, who killed himself shortly after his 21st birthday. He had gone to the UK, he'd been injected, there was COVID, there was drama, he had to come back, and he was then sent to a psychiatrist in South Africa who put him on 4 different drugs, including alprazolam, which is not always available in Zimbabwe. And he went into withdrawal. I don't know what he took off the street, but he very successfully hanged himself. And it was such a tragedy, because he was possibly the most giving, nice person that I knew. And who killed him? did he kill himself, or was he in a state of withdrawal with absolutely no frontal lobe function? Why are we not talking about people who have had problems? Robert Downey Jr. is probably one of the wealthiest in the planet, certainly in the acting world. And his comment is, remember that just because you hit rock bottom doesn't mean you have to stay there. Anthony Hopkins is over 45 years sober, having been pulled out from under a grand piano in Hollywood and leaving his car behind and being put in a taxi home, and his wife, his ex-wife, never spoke to him again. So he says that if you're an alcoholic or a drug addict, we flirt with death. We pull ourselves to the brink of destruction, and if we're lucky, we pull ourselves back. But his most important comment is that we all have that in us. And when we point fingers at people, there are often 3 fingers pointing back that we're not aware of. My favorite actor of all time is this man, Robin Williams. You're only given a little spark of madness, so you mustn't lose it. I love that quote. But in his movie Jack, when he says, make your life spectacular, how can we label this person as someone who's lying in a gutter or living in a box under a bridge? And these are very important words from Robert Williams, which could be used for family members and for doctors. And that is, I used to think the worst thing in life was to end up alone. It's not. The worst thing in life is to end up with people who make you feel alone. And I have many patients who relate very strongly to this because they can't get away from their families who completely ostracize them. So you need to fix the relationships. I've put the links in: management of stress and uncertainty, healthy boundaries, routine, the power of relationship intelligence, purpose, meaning, fulfillment. That is the way to get someone better. And again, it's not about sobriety, it is about connection. And belonging is a deep sense. A deep sense of love and belonging is an irreducible need of all people. We are biologically, cognitively, physically, and spiritually wired to love, to be loved, and to belong. And I think a lot of this failure to belong is behind this whole transgender movement. And when these needs are not met, we don't function as we were meant to. We break, we fall apart, we numb, we ache, we hurt others, and we get sick. Brené Brown, if you want to read inspirational quotes, is highly recommended. So what can we do? The Friendship Bench is about connection and cognitive behavioral therapy. There is plenty of evidence that shows that grandmothers who would otherwise not be utilized can have their natural life skills upgraded and can perform excellent cognitive behavioral therapy. And in fact, Dixon Chabanda has shown that trained grandmothers completely outperform doctors because they have time, they have humility, they have wisdom, where wisdom is knowledge and experience. Knowledge is not the be-all and end-all of life. Wisdom requires experience. They have empathy, listening skills, they're connected, they nurture, they create a sense of belonging, they're caring. And they also have a purpose when they work on the Friendship Bench. Grandmothers actually have a lot more roles in life when it comes to addiction because they may be herbalists and they may be able to give things. In Ayurvedic medicine, we use ashwagandha as an alternative to diazepam to reduce cortisol. But they're also the family chef. And if we know that addiction is partially a disease of poor nutrition, nothing will work until this is corrected. So we have to stop the toxic substances. We have to reduce the craving, but we also have to restore nutrition. And in 1977, Libby and Stone demonstrated that addiction is a disease and poor nutrition. And if they gave people high dose vitamin C, other vitamins, minerals, and protein, they got better. 30 out of 30 heroin addicts were able to give up for 30 days without any other drugs, but they were using very high dose vitamin C. Vitamin D is totally under recognized. Our 51-year-old man who's doing death by duvet probably has a vitamin D of about 10 and hasn't had any sunlight for months and probably has a gaming addiction as well. We know vitamin D affects serotonin. It affects mood as well as neuroplasticity and the ability to form new behaviors. We know that the deficiency strongly exaggerates the craving for opioids. And if we supplement, it will combat addiction. We know that the dopamine pathway is heavily involved in addiction. And we know that the vitamin D receptors and vitamin D is involved in both the production of dopamine and its breakdown by catechol O-methyltransferase. In HIV patients, they are often D deficient because of the ARVs, and we can improve immunity, reduce craving, improve their mood, and for those who are on TDF and are getting osteoporosis, we can improve their bone health. And vitamin D in Africa is free. These guys playing soccer in the sun also have movement as therapy. The more you move, the more you create highways in the brain between the frontal lobe and the occipital lobe and the motor cortex and the parietal cortex. And movement as therapy is becoming huge, and kids should be encouraged to play as much sport as possible. So if we want to reduce craving in our 51-year-old man, we need to give him all of the vitamin remedies. We need to get his microbiome right. He needs to get out into the sun and move, and he needs support. And it's not a case of which one is best. You need all of it. With neurolinguistic programming, I put a link on the chat. I don't think I'm going to have time to play it. But basically, it's conscious versus subconscious thinking. And if your conscious mind, so if you say, I hate myself, there's an I and there's a myself. The myself is the behavior, the I is your higher self. And if there's incongruence and they're not aligned and you aren't behaving as your higher self, you will be disturbed. So the patient wants to stop but doesn't want to stop. And you can't access the subconscious by saying you have to stop, because the subconscious is going, I have no other solution for my anxiety. And this clip in particular shows very well how to access the subconscious mind. And instead of telling someone to stop thinking of a cigarette, it's like, don't climb up the curtains. You basically get them to replace it with something that they're passionate about. And locking them up is not going to do that. So we've been through this, the holistic management, psychological rehabilitation. I'm going to touch on orgone therapy, but we have a full lecture on this for an hour on the 14th of March. William Reich was a student of Freud, and he addressed the psychological and physiological underpinnings of chronic emotional distress. I think that anybody who survived the last 3 years probably has chronic emotional distress. And he speaks of character formation, the biological basis of emotion expression and blockage, psychosomatic disorders, and the nature of life energy, which Reich termed orgone. He was a student of Freud's, and he elaborated on the defense mechanisms, and he was the first Western scientist to fully demonstrate that the mind and body are not separate. We talk about psychosomatic disease as though the brain operates completely independently of the body. It's the operating system, and it's the major organ for our body. But our mind is not separate from our physical being. And Reich speaks of armoring. So people armor because it's a survival tactic. And there's inhibited breathing, chronic muscular tension, and you're ready to defend and attack if necessary, which is great if there's a lion around. But when this coping mechanism, when the threat goes away, you should be able to relax. But in 2024, the threat doesn't go away because it's financial, or it is political or circumstantial. So this armoring becomes pathological. And orgone therapy works towards dissolving armored blocks and freeing bound emotions, and reduces painful symptoms such as depression, confusion, anxiety, inappropriate rage, substance abuse, and various other self-defeating behaviors. But it also focuses on a deeper capacity to assertively reach for desired goals such as joyful work, deeply loving expression, creative pleasure, and the ability to feel deeply, think clearly, and see the world realistically. Armoring is beneficial until it becomes chronic, and if the adverse stimuli are severe enough, so people with PTSD, or continue for an extended period of time, such as someone in an abusive relationship for 20 to 30 years, then the physical, emotional, and psychological defenses become chronic, and we become stuck. And it limits our capacity to have flexibility in our emotions and our behaviors, and we cannot develop a full and satisfying life. So how do you get your life back, and how does your patient get his life back? Well, you have to undo the blockages that often go back to childhood. And according to Reich, emotions emerge from energetic movement, and when it's blocked, energy is blocked. Unexpressed emotion tends to be buried alive, and like any living creature deprived of air, eventually comes roaring to the surface months or even years later, demanding its time and toll on the human spirit. Gabor Mate, I highly recommend. He is a Polish Jew. His parents were in the Holocaust. They gave him aged 1 to some Canadians, and they were both executed. And his story is fascinating, but his whole thing is not ask why the addiction, but ask why the pain and treat the root cause. He also is very into boundary setting, and I think a lot of us as doctors need to know that being nice can kill you because we don't set appropriate boundaries. So Howard Chavis will talk on the 14th of March, 2024 on a different kind of psychiatry, medical organ therapy, and I'm looking forward to that. How do we recover from this mess? Because post-COVID, we seem to have lost all the enthusiasm and joy of our young people. We can do point of care testing, but then the question is, what do you do with the results? You now have somebody and you're going to punish them with expulsion, or they're going to lose their job. But point of care testing was done by Emirates. When I worked for them, it was done randomly, and the drug problem went away overnight because you only had to test 2 or 3 people a day, and people knew that it could be them at any time. If we want to fix relationships, we have to learn to calibrate expectations. So the expectation that someone's going to go to rehab for 3 weeks and come back cured is unrealistic. The people, both in the family and outside of the family, because there's often a codependent relationship, need to diversify their social connections. Taking risks can come later, but if they want to go bungee jumping, it's not a bad idea as long as there's a rope. And doing new things that stimulate the brain will make a huge difference. In Zimbabwe, we have the Youth Advocates of Zimbabwe. This link will go to a story of a girl who goes through YAS training, which is a month of online training courses, which I'm hoping to run through Intellectus Campus. And it goes through leadership and HIV and physical development and sexual reproductive health rights and responsibilities. And this young woman went from being suicidal to being empowered to help others overcome challenges similar to those she faced as a young mother. She had 2 children in the COVID years, and she was 15 and 17 when she delivered them. We have youths uniting against drug abuse with martial arts. We need to realize that thousands of people under 21 die in alcohol-related car accidents per year, and alcohol is probably the biggest concern. Yes, we do have cocaine and methamphetamine here, but the problem is the destruction of our societies. It's not necessarily the drugs. And it is the impact of our combined efforts that will challenge things in the long run. So it takes a village to raise a child. We need youth leadership programs. We need grandmothers. And doctors need to understand and tailor psychological strategies. And young people need to be trained in skills. Martial arts, basketball, both involve crossing the midline. They heal the brain. So what is the opposite of addiction? It is connection. First, do no harm. Let's start treating people with acceptance, with reason, with willingness, with neutrality, and let's stop shaming them and putting them in a state of fear and locking them up. The only good is knowledge, and the only evil is ignorance. And with that, I will end the presentation and I'll open the floor for questions. All right, Belle, I'm going through the chat, and as you know, technologically, I'm not brilliant. Are there any questions in the chat? Because I wasn't watching it at all.
Hi, I really thoroughly enjoyed this. I'm coming from a family where there has been alcohol, abuse and also then prescription drugs. This was exceptionally interesting. I just wonder, the opposite of addiction is connection. I've had friends who also had like this addiction pattern. And I found coming from this background, it has actually been exceptionally difficult for me to try and connect with these persons in my life that I try to do sport with, to bring them to connection because it pulled me down. So it's so difficult. Any ideas on this?
Yeah, thanks for the question. It's a really important one. So the first thing is you mustn't, it's a very fine balance. You mustn't enable someone to continue with behavior that's unacceptable, and you mustn't reward behavior you don't like. So if they really are not interested in giving up and they don't think they've got a problem, then sometimes they need more pain. And by being nice to them and being very accepting of them, I'm not saying you have to treat them with contempt, but you can distance yourself and be available, but set your own boundaries on them. And when they're ready, you need to be able to treat them with neutrality and with optimism and say, right, you want to get your life straight. Keep this presentation. These are the nutritional supplements you need. We need to wean you down off. I mean, I've got a patient who's drinking 3.5 bottles of whiskey a week, and he decided to stop. And on night 3, he thought he was having a seizure, and he probably was. Okay. So this cold turkey stuff, rather set a goal and say, next week, I'm going to only have 4 whiskeys a night. And then the week after that, it's 3, and then 2, and then 1. And wean yourself down off the substance. And help people to do this in a new way, which is wean off the substance, be firm that your life will be much better without it. Get people to see a future without the substance that is better than the future they have now. Because the pain of change will only happen when the pain of staying the same is greater than the pain of putting in the effort to change. So it is a tightrope to walk, but if people really are not interested in getting better and they're adamant there's nothing wrong with them, then play your sport with them and then just say, so your behavior is just kind of getting a bit out of control. I'm going home now. And sooner or later, they'll look around, and when there's nobody left, they'll need to reach out and make those social connections. But it is a fine line. Some people do have to be admitted to rehabilitation centers. We're hoping to open a very novel rehabilitation center in Vic Falls. It's about 2 years out, I would imagine. And it will basically be in quite a remote place. So you can leave anytime you like, but there's quite a lot of lions and elephants around, so you take your chances. But the beauty of the area and the therapies that will be introduced, which will include proper yoga, proper movement, and explaining to people why they're throwing a beanbag from one hand to the other and crossing the midline. Those kind of things will be designed so that people understand their rehabilitation rather than enter a center that breaks them down completely and it's almost impossible for them to get out. So I don't have all the answers, but I don't think anyone does. But it's a fine line between enabling bad behavior and not being contempt.
Thank you so much for this answer, Jackie. I just wondered, coming from a background like this, do you think it is ideal for a person who comes from the background like me to actually be involved with people like that? Because I've heard about like second generational alcoholism, where you don't even drink, but you are the second generation. So I just found this has pulled me down so much, the healer or the need to be needed to heal somebody. Would you say, in your experience, that a person who's been exposed to this is ideal or not ideal to be involved with people that has addictions?
I think it's a very personal thing. You need to understand that someone who doesn't drink may still be restless, irritable, discontent, because when you listen to people, there's a guy here who runs a place called the Sober Lodge, and he's a very, very interesting person. I'd like him to speak. And he talks about an emotional relapse. So people who've stopped drinking just suddenly enter this dreadful, irritable, disconnected state. And there are quite a lot of what we call dry drunks, who are people who become very agitated, and it's got nothing to do with the substance. So the first thing I would say is protect yourself at all times. If something's being too overwhelming, be honest. Just say, I'm too overwhelmed with your behavior. I have a cousin who, and we admitted to the Sober Lodge, and I learned a great deal. His mom died, my aunt died, and he just completely went to pieces. And I learned a huge amount by watching his journey and how he was gently tapered off substances, how his nutrition was cared for, how his mental health was cared for, and how he was nurtured back into being a new person. But that was done by somebody who had experience, and a lot of experience and training in the area. So you can train further in the area. I think that if you've got experience with alcoholism, you will probably be more understanding of it. And you will also understand that to enable someone, you can kill them with kindness. So, number one, look after yourself first. Number two, don't try and do it. Right, please, can we mute whoever's unmuted? Faith, please mute your microphone. Cool. Sorry about that. So I think that you are in a very good position, but I don't think you should try and do it on your own, and I don't think you should do it without training. What's your background? Are you a GP or a psychologist?
Jackie, I'm a radiographer basically, but I have also trained, I've studied psychology, law, criminology, trying to save the world through knowledge. And then I became a craniosacral therapist, which is my passion. So it's all in order to help people. So I thoroughly enjoyed your part on the consciousness levels. It made sense, to try and connect and your level on consciousness that's measurable from hatred on a level of 20 to love and connection on a level of 400. So that's where I am about, just having this understanding of something more than psychology and medicine.
So my time in the Middle East, I worked for 12 years for Emirates, and we had 135 different nationalities, and you would diagnose someone and they'd go off to their Chinese acupuncturist, or they'd go off to their Korean doctor or their Ayurvedic doctor, but they all got better. So Western medicine does not have a monopoly on healing. And that was my biggest lesson coming out of the Middle East. And everybody over 40 in the Middle East is on ashwagandha, and it's supposed to be one of the 7 Ayurvedic top herbs, and nobody in the conventional medical world has ever heard of it. So I guess you need to be very open to a lot of the different trainings. I think you need to analyze your need to save the world. If you're from an alcoholic family, then you will have a high need to control because your childhood was probably out of control. And in the Gabor Mate's work, he basically says that being nice will kill you, because you've got to be sure that you're not just people pleasing, because people can spot a people pleaser a mile away. So I think protecting yourself is important, and getting yourself as educated as possible is important. Being open-minded to other strategies is important. So one of the women that I refer patients to works out of the Rockpa Center in Harare, and she doesn't look like she should be in a Buddhist center, because she looks like a school teacher, because she's so conventional and pearls and perfect hair. But she basically speaks a lot about channeling energy. And so she has learned from someone who came out from the Far East how to protect her energy field. And she says there's abundant energy out there. She grounds herself on the soil, and that the soil has negative ionic energy, and the magnetic force of the earth is something that nobody can deny, because gravity always wins in the end. And we can actually get energy from sun, we can get energy from grounding ourselves. And if people take our personal energy, we have to protect that. But we can teach them to go and get their own. So the energy suckers will leave you feeling completely drained. It's your heart sink patient. It's, oh no, when you see their name on the list. But what that person needs to do is to stop being a victim and take responsibility for their own life. And for as long as you rescue that person, you are robbing them of an independent life with a positive energy system. And the cruel to be kind, my grandmother always spoke about being cruel to be kind, but you do have to put people in a position, and I don't know if you've got children, but I've got 3. And one of Jordan Peterson's rules for life is make sure other people like your children, because if you don't like them, other people won't like them either. So you have to learn with children that there's a boundary to be set, and if they cross it, there's a consequence. And if you've grown up in an alcoholic home, the probability is that you will tiptoe around on eggshells and let everyone suck your energy and your life force out. So you have to learn to protect your own energy field.
Thank you so much. I really appreciate the irony. If I can just leave it at this now, that other people can also talk, is the irony. My dad, who's been the functional alcoholic, very high in government and stuff, that was okay. I could kind of cope with that. My mother, who got addicted to prescription drugs, that was the worst of the 2 evils. So I'm just leaving it at that. I got a lot of information from you, advice, and then also for anyone else here, because I think there are many people like me. In the end, becoming a therapist, even if it's a craniosacral therapist, working a lot with the limbic system, cerebrospinal fluid, and harmony and balancing, it has set me free. It has put up boundaries, because I got knowledge, and I've got that safeguard of now I'm a therapist. I'm not just somebody wanting to save the world. So thank you so much. I appreciated this talk thoroughly. I enjoyed it and appreciate it so much. Thank you so much. Hey?
No problem. Pride, you just heard that. Probably everyone just heard that phone call. Pride, you can stop recording.